Hello, everyone. Welcome to LUMP webinars featuring basic TCM and acupuncture. Let's welcome our first presenter for today, Ma'am Neets Yu of Silang, Cavite, certified acupuncturist. Good afternoon, Ma'am Neets.
Good afternoon, Doc Hector. Once again, everyone. So the topic for today in our 18th day is blood, sweat. According to pattern identification, yeah. The pulse, yung classic pulse is unsmooth and tight or choppy, or thin and rough with irregular rhythm like scraping of bamboo surface, lightly with a knife. Yun po yung choppy. Okay? Blood stasis in the liver, yun yung wiry or firm pulse. Yan, wiry, parang wire. Blood stasis in heart, choppy or knotted pulse. Okay? Blood stasis due to deficiency pattern, deep, weak, and choppy pulse. Deep, malalim. Okay? Sa masses or tumors, it is a result of blood stasis and or phlegm accumulation. Larger or firmer fixed masses or tumors are associated with blood stasis. Yun yung intra-abdominal masses. Okay? Bukol. Western laboratory findings, increase or decrease in hematocrit or packed cell volume, increase or decrease in red blood cell counts, increase or decrease in platelet counts, increase in albumin or total protein, increase in cholesterol or triglycerides. Okay? Food therapy for blood stasis. It aims to increase foods that promote circulation to remove blood stasis, to avoid foods that can impair the circulation. Example po yung mga cold foods. Yan. It can impair circulation. Food therapy for blood stasis, yun yung warm food. Katulad ng shrimp, oats, mustard leaf, peach, hawthorn fruit, chestnuts, vinegar, ginseng, black pepper, and turmeric. Yung mga cool food naman, yung crab, mung bean, asparagus, eggplant, kelp, celery, and banana. Neutral food, katulad ng black fungus, yung wood ear mushroom, potato, shiitake, and kidney beans. Okay? Yan po yung mga titik nyo. Thank you very much, everyone.
Thank you very much, Ma'am Neets. Up next is TCM, causes of disease. And let's welcome emotional pathogenic factors, rather. So let's call on Ma'am Teresita Sumile of Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Let's now continue our study on emotional pathogenic factors, and now let's talk about worry. Worriers tend to worry with their stomach. This could cause problems such as no appetite, pain, hyperacidity, and nausea or vomiting, or it may be that the person will eat obsessively. In order to decide how the worry is attacking them, we should see how they behave when they are worried about something. They could be active worriers or become more passive than worried. They could even be quite obsessive about their worry. Okay? Now, in stomach yang excess consumes yin. This could be an imbalance in a person who has serious responsibilities in life. Active warrior is an active person and takes the responsibility to actively solve the problem. Have to do everything themselves, have difficulty delegating. This increases stomach yang. The acidity and colic leads to vomiting, pain, and they cannot eat well until they are calm again. They often lose weight during worrying periods and may have gastric ulcers. So we need to treat this case by tonifying yin and sedate the yang by using acupoints REN 12, which is the move front point of the stomach, spleen 21, loop point of spleen, pericardium 6 for calming the stomach, do 20, liver 3 for giving some distance from the problem. Next is excess stomach yin consumes qi. When worry has been thrust upon someone who has had a protected life in the past, they are lazy people and become more passive when worried. Will not do very much about the problem, but can't be left alone to worry peace. They always depend on others to solve their worries and become angry or sad when help is not given. They tend to eat more when worried and increase in weight. Their spleen function is affected during these periods, causing circulation problems, diabetes, and so on. So we should sedate yin and tonify yang by using UD20 or 21, alternate bakshu points of spleen and stomach, pericardium 6, distal point, stomach 40, loop point of the stomach, kidney 6 to move the energy, and moksha on REN 12. Then, next, spleen, stomach, blood, and qi deficiency. Could be someone who has had quite a worrying life, or who is already quite weak in the spleen and stomach. A person who looks for worry and takes worry to heart. If they do not have a worry, they will seriously become worried about that. A control freak needing to repeat actions such as cleaning or tidying or checking on the same thing several times, they cannot stop even if it makes them tired. You'd have anorexia nervosa, obsessive compulsive disorder. So in this case, we need to tonify both yin and yang by using REN 12 and UB21, spleen 3 and stomach 36, do 20 and pericardium 6, and moksha on REN 12. Thank you so much for your attention.
Thank you very much, Ma'am Teresita Sumile. We now go to yin-yang relationships. And for today, we're going to we will start with the topic on the Shen, or the mind. The Shen is the most subtle and non-material type of qi. It is often translated as spirit, which is actually a complex of 5 mental spiritual aspects of the human being. So we have the ethereal, so these are the 5 mental spiritual aspects. The first one is ethereal soul, the hun, pertaining to the liver. Corporeal soul, the po, pertaining to the lungs. Intellect, e, pertaining to spleen. Willpower, chi, pertaining to kidneys. And the mind itself, which is the Shen. Essence is origin and the biological basis of the mind. Life comes about through essence. When the 2 essences unite of the mother and father, they form the mind. The 2 essences, one yin, one yang, they unite to form life. Essences of mother and father will unite to form the mind. The mind of a newly conceived being comes from prenatal essences of the mother and father. After birth, the prenatal essence is stored in the kidneys, and this provides the biological foundation for the mind. So the life and mind of the newly born baby also depend on nourishment from its own postnatal essence. When the stomach and intestines are coordinated, the 5 in organs are peaceful, blood is harmonized, mental activity is stable. Mind derives from refined essence of water and food. Thus, mind draws its basis and nourishment from prenatal essence stored in the kidneys and postnatal essence produced by stomach and spleen. Hence, we have the 3 treasures: the mind, the chi, and the essence. So the mind is housed in the heart. Chi, produced by stomach and spleen. Essence is stored by the kidneys. So the 3 treasures represent 3 different states of condensation of the chi. The essence being the densest, chi more rarefied, and the mind, which is the most subtle and non-material. The activity of the mind relies on the essence and the chi as its fundamental basis. So if you wish to really determine the Shen or evaluate the Shen of a person, you need to know the status of his essence and chi. Essence is the foundation of the body and the root of the mind. If essence and chi are strong and flourishing, the mind will be happy, balanced, and alert. If essence and chi are depleted, the mind will suffer, may become unhappy, depressed, anxious, and clouded. If the essence is strong, chi flourishes. If chi flourishes, the mind is whole. State of mind affects the chi and essence. If the mind is disturbed by emotional stress, becoming unhappy, depressed, anxious, or unstable, it will definitely affect the chi and or the essence. So all 3 will affect each other. In most cases, it will affect the chi first, since all emotional stress upsets normal functioning of chi. Emotional stress will weaken the essence, either when combined with overwork and or excessive sexual activity, or when fire generated by long-term emotional tensions injures yin and essence. The mind is most closely related to the heart, which is the mind's residence. The heart is the monarch of 5 in organs and 6 yang organs. So to summarize, we have the functions of the mind, or the Shen: consciousness, thinking, memory for insight, cognition, sleep, intelligence, wisdom, ideas, affections, feelings, and senses. All of this shall be taken up one by one in our future lectures. Thank you very much for your attention. Up next is the 5 elements. We will continue with so we are still on diseases of the fire element. We shall take up stammering. Treatment, local points, REN 23 and SI 17. Symptomatic points are DO 20, pericardium 6, lung 7, and the energy balancing points. So for the hyperactive heart yang, so the heart yang compared to the yin is relatively very active. So even if it is within normal, but in relation to the yin, it's very active. So we need to do treatment by using low connecting point, heart 5, and front mu point, REN 14. And another cause for stammering is liver yin deficiency. So we use liver 3 or liver 5. Chronic stammering is due to heart yin deficiency. It worsens when a person is anxious or nervous, when the heart yang increases. Heart 5, which is the luo connecting point, tonifies the yin and sedates heart yang. Ren 14, the front viewpoint of the heart, cools and calms the heart. Liver 3 is a symptomatic point against nervousness. We can alternate liver 3 with liver 5, which is the luo connecting point, which also tonifies the yin and sedates the liver yang. The local points, Ren 23 and SI 17, are very useful to relax the tension at the tongue base. So we do this 2 sessions a week for 4 sessions, then 1 session a week, another 4 sessions, then 1 session fortnightly, 4 sessions. Now let's go to slurred speech and lisping. Treatment, we use local points, Ren 23 and SI 17, distal points, LI 4, and the energy balancing points. So we have here heart blood stagnation and liver qi deficiency. For heart blood stagnation, we use the bakshu of the heart, which is bladder 15 and SI 7. For liver qi deficiency, we use the bakshu of the liver, which is bladder 18 and gallbladder 43. Slurring, lisping, and speaking with the mouth closed are speech problems relating to heart qi deficiency. These cause difficulties in being understood, and acupuncture treatment can greatly help improve articulation. Bladder 15, the bakshu point of the heart, improves the function. SI 7, the luo connecting point of the small intestine, circulates the stagnating yin by tonifying the yang and sedating the yin. Liver points are used to improve the muscle movement. So 1 to 2 sessions weekly for a total of 14 sessions. Thank you very much for your attention. We now listen to Ma'am Teresita Sumile for her discussion of the TCM causes of disease. Good afternoon once again, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Now let's continue our studies on the causes of the disease. Now let's talk about cold. Cold lacks warmth, creates a slow or immobile landscape. So we have 2 causes of cold, external and internal. External comes with wind. There is a feeling of cold, blankets, no more chills than fever, curled up, contracts under activity, slow black spores, no sweat, discharges are clear or white. In meridians and muscles, it contracts, causes pain that is cramping or sharp and severe. It responds to the application of heat, vacuity of qi in case of deficient cold. Sa internal naman, merong feeling of cold. Blankets help hands, feet, or whole body curls up. Underactive slow movements, slow functions of organs and systems of the body, like metabolism and digestion. Difficulty relating in relationships, pain in organs, cramps, sharp vacuity of qi, blood. Then in excess type, diet, deficient type, jing overwork, which leads to deficiency of qi or blood. Next is heat. Yin or yang, cold and heat can turn into each other, creates an agitated landscape. Heat is a normal aspect of the body. In external heat, there is a feeling of hot, more fever than chills, no blankets, sweats, discharges are red or yellow. Then color of face, eyes is red. And fire poisons, inflammation can dry up or consume the yin and can feel hot. In external, there is a feeling of hot, no blankets, no sweats, extended posture, fast movement, pain feels like burning if excess tight. There is restlessness, hyperfunction of body systems and organs, insomnia, dry stools, eyes, profuse bleeding, and in deficient, there is anxiety, acute or prolonged emotional problems, cause heat, rising symptoms, BP, and migraines. Next is dampness. Not as clear a distinction between internal and external dampness. Dampness is an external pernicious influence that quickly becomes part of the landscape and is very difficult to treat. Can also be generated from the interior. Characteristics include wet, heavy, and slow. Transformations get bogged down is caused by and affects the spleen, particularly the digestive system, like nausea, vomiting, loose stools, lack of appetite, and overweight. Combines with heat in the exterior of the body and in the organs. Combines with cold, especially in the organs, like uterus, stomach, and intestines. Manifests in the limbs and lower part of the body, like heavy, numbness, achy, and edema. Pain is diffuse without clear boundaries, soft, mushy flesh, and muscles. Non-physical, like worry, too many thoughts, holding on, and clingy. Thank you so much for your attention.
Thank you very much, Ma'am Teresita. Up next is Zangfu organs. Let's listen once again to Mom Needs You. Okay, let's welcome Mom Needs You for
Good
Zangfu.
afternoon, Doc. Good afternoon, Doc Hector. Nauna pa ako. Excited. Thank you, Doc. So, topic for today, liver blood deficiency. Okay. It is considered as initial stage of liver iron deficiency. Cardinal symptoms, vertigo with gradual onset, scanty menstrual bleeding with pale reddish blood, dryness of the eyes, blurred vision, night blindness, tremors, feeling of numbness or tingling. Okay? Yun yung vertigo. Let's go to vertigo. The brain is not nourished sufficiently due to liver blood deficiency. Okay? Scanty menstrual bleeding kasi blood is deficient, kaya konti lang. Okay? Pale colored brittle fingernails. Liver manifests in nails. So, nails not nourished sufficiently, it is due to liver blood deficiency. Okay? Quivering, insufficient nourishment due to liver blood deficiency, it brings on hypertonicity of muscles. Okay? Muscle cramps, there is insufficient nourishment due to liver blood deficiency, so it brings on hypertonicity of muscles. Okay? Tremor, there is insufficient nourishment due to liver blood deficiency, so it brings on hypertonicity of the muscles. Kaya nagkakaroon ng tremor, nanginginig. Okay? Muscle weakness, there is not enough blood to supply the musculature. Sorry for pronunciation. Muscle weakness po yun. Okay? Feeling of numbness and tingling in extremities. There is not enough blood to supply extremities, so there is sufficient blood liver blood deficiency. Sorry po. Na-excite. Blurred vision, eyes not nourished sufficiently due to liver blood deficiency. Okay. Dryness of the eyes not nourished sufficiently and become dry due to liver blood deficiency. Yun po. Night blindness, eyes are not nourished sufficiently, so this is due to liver blood deficiency. Okay. Dami, no? Floaters, eyes is not nourished sufficiently due to liver blood deficiency. Okay. Let's go to liver iron deficiency. It is the result and further complication of liver blood deficiency. Okay. Cardinal symptoms, additional symptoms of liver blood deficiency, 5-star heat, 5-center heat, night sweats, tinnitus with gradual onset. Okay, mainit. Thank you for your attention, everyone. Sorry for mistakes.
Thank you very much, Ma'am Needs. That was very helpful. Now let's proceed to Meridian Theory. This time, we start a new chapter, Heart Channel of Han Shaoyin. The heart meridian starts at the mid-axilla, anterior to the axillary artery. According to the classics, this is a forbidden point for needling, but in case one needs to use it, a compromise point at the end of the anterior axillary fold could be used. The meridian flows along the medial ventral side of the arm on the palm and ends at the radial corner of the nail of the little finger. The interior part of the meridian originates from the heart, as you can see on the figure. It also enters the small intestine, the coupled organ. The upper part of the inner branch runs up to the larynx and further on to the eye and brain. Heart 1 is located with the arm abducted in the center of the axilla, anterior to the axillary artery. This is the first and the entry point of the heart meridian, as it receives energy from the previous spleen meridian. If it should be needled, a point at the end of the anterior axillary fold could be used. Then we have heart 3. Heart 3 is located with the elbow flexed at a right angle. This is in a depression between the ulnar end of the transverse cubital crease and the medial epicondyle of the humerus. This is also called the laughing point. Heart 3 increases heart yang. It is the water point and the grandmother point of the channel or meridian. Heart 4 is located 1.5 tun proximal to the transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 4 is the metal point of the heart and could be used to sedate heart yin as well. Heart 5 is located 1 tun proximal to the ventral wrist joint space, the most distal transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 5 is the luo connecting point of the meridian, used to tonify the yin and reduce the yang. It is a very good point to treat stammering. Heart 5. Good for mental restlessness, hoarseness of voice, and chronic insomnia. Heart 6 is located 0.5 tun proximal to transverse wrist crease on the radial side of the tendon of the flexor carpi ulnaris muscle. Heart 6 is the she-cleft point of the heart. She-cleft points are generally used in acute and urgent situations of the organs. And this could be used in anxiety, excessive sweating. We are reluctant to use this point in minor problems such as sweating, but it could be suitable in angina pectoris. The author is more comfortable using pericardium 4, which is the she-cleft point of the pericardium. In every instance that using the she-cleft point of the heart is required so that we do not over-sedate the heart. Heart 7 is located on the ventral aspect of the wrist joint space, the most distal wrist crease, radial to the insertion of the tendon of the flexor carpi ulnaris muscle. Heart 7 is the Yuan source point and sedation point. It is an excellent tranquilizing point called Heaven's Gate. When heart 7 is sedated, it would sedate more of the yin than the yang. So we should be careful not to use this point if the heart yin is too low. Points heart 4 to heart 7 are all on the radial side of the flexor carpi ulnaris tendon, and starting at point heart 7 at the distal wrist fold, they are 1/2 soon proximal to each other. The problem in most practical sessions has been to locate the distal wrist fold exactly. This should be the most distal and full fold away from you. If this is located incorrectly, then every time you wish to needle point heart 7, you will be in point heart 6. And heart 4 will be given instead of heart 5 and so on. Remember, it is not the intention that gives results in acupuncture. The points give results. Now let's talk about heart 8. This is located on the palm between the 4th and 5th metacarpal bones. Heart 8 is the fire point and the house element point of the heart meridian. It is extremely effective in tonifying heart yin. One of the best points in the treatment of gallbladder meridian headaches. It is important to improve memory and sleep. So remember heart 8. And finally, we have heart 9, located on the little finger, point 1 soon, lateral to the radial corner of the nail. Heart 9 is the tonification point and the wood point of the heart. A very good point in the treatment of performance anxiety. It increases mostly the heart yin and some yang. Heart 9 is not very suitable in the treatment of insomnia, as the increased heart yang would make the patients more restless. Heart 9 is the last exit point of the meridian before it flows into the small intestine at point SI1. Thank you very much for listening. We finally come to the last topic for today. We are still on breathlessness, patterns and treatment, number 8. Now let's talk about the lung and kidney yang deficiency, fluids overflowing to heart and lungs. Clinical manifestations, chronic breathlessness, cough with expectoration of white watery sputum, feeling of oppression of the chest, palpitations, edema, scanty urination, and chilliness. Tongue is pale, swollen, and wet. Pulse deep, weak, slow. This condition is due to yang deficiency of lung and kidneys, leading to accumulation of phlegm fluids in the lungs and heart. Expectoration of white watery sputum is typical of phlegm fluids. So if you have a patient and you have to ask the consistency and the color of the sputum. So if it is white watery sputum, this is definitely phlegm fluids. Treatment principle, tonify and warm lung and kidneys, resolve phlegm fluids, stimulate the descending of lung qi. Points, lung 7, Li 6, Ren 17, Ren 12, Ren 9, Ren 6, kidney 7, spleen 6, stomach 40, pericardium 6, bladder 20, bladder 23, bladder 22, bladder 13, bladder 15, all reinforcing except for lung 7, Li6, and Ren 9, which should be needled with even method. And we can do moxa. Lung 7, Li6, and Ren 17 stimulate the sending of lung qi and open the lung water passages to resolve edema. Ren 12, Ren 9, and Ren 6 tonify qi and resolve edema. Kidney 7 and spleen 6 tonify kidneys and resolve edema. And we all know that stomach 40 resolves phlegm. Pericardium 6 opens the chest, thus relieving the feeling of oppression of the chest and tonifies heart yang. Bladder 20, bladder 23, and bladder 22 tonify the spleen and kidney yang and stimulate transformation of fluids in the lower burner to resolve edema. Bladder 13 and bladder 15 tonify the lung and heart yang. Now let's go to another pattern, lung, heart, and kidney yang deficiency, fluids overflowing to the heart. Clinical manifestations, chronic breathlessness, feeling of oppression and pain of the chest, nausea, cyanotic lips, purple face and nails, expectoration of white watery sputum, difficulty in lying down, edema, chilliness, lower back ache, weak knees, scanty but pale urine. The tongue, bluish purple and swollen. The pulse is deep, slow, knotted. This condition only occurs in old people suffering from chronic breathlessness. It is characterized by yang deficiency of the lungs, kidneys, and the heart, leading to formation of phlegm fluids, manifesting, if you recall, with white watery expectoration. This overflow to the lungs and the heart. In the lungs, they further impair the descending of lung qi and aggravate the breathlessness. In the heart, they obstruct the circulation of blood in the chest, leading to pain in the chest and cyanotic color of the face, nails, lips, and tongue. Kidney yang deficiency causes backache, weak knees, and scanty urination. Treatment principle: tonify and warm lungs, heart, and kidneys, resolve phlegm, restore descending of lung qi, invigorate blood, and eliminate stasis. Lung 7, Li6, Ren 17, Ren 12, Ren 9, Ren 6, kidney 7, spleen 6, stomach 40, pericardium 6, bladder 20, bladder 23, bladder 22, bladder 13, bladder 15, bladder 17, spleen 10. Reinforcing method except on lung 7, Li6, Ren 9, spleen 6, and stomach 40, which should be needled with even method. And we use moxa. Lung 7, Li6, and Ren 17 stimulate the descending of lung qi and open the lungs water passages to resolve edema. Ren 12, Ren 9, and Ren 6 tonify qi and resolve edema. Kidney 7 and spleen 6 tonify the kidneys and resolve edema. Stomach 40 resolves phlegm. Pericardium 6 opens the chest, thus relieving the feeling of oppression and tonifies heart yang. Bladder 20, bladder 23, and bladder 22 tonify the spleen and kidney yang and stimulate transformation of fluids in the lower burner to resolve edema. Bladder 13 and bladder 15 tonify the lung and heart yang, and bladder 17 and spleen 10 will move the blood and eliminate the stasis. Thank you very much for your attention and see you in our next presentation. Thank you everyone for joining.